Okay, we are back talking about these MCQs for cancer drugs, for CV drugs, for antimicrobials, and hormones, etc. Okay, we just talked about this one, so let's move on to, just in case you're joining us, Michael has been treated for an ongoing cardiac problem, and we're trying to decide. He's taking these 6 flecainide tabs a day using the Vaughan Williams classification. This is an example of what? The answer is a class 1 drug. Next one, which of the following drugs is an example of a class 3 antiarrhythmic of the Vaughan Williams classification? A. Amiodarone, B. Lidocaine, C. Propranolol, D. Verapamil, E. Adenosine. The answer is A. Amiodarone. So, what phase of the cardiac action potential do the beta blockers affect? Is it phase 1, A, B, phase 2, C, phase 3, D, phase 4, E, phase 1 and 3? The answer is D, phase 4. Is what the cardiac action potential. What phase of the cardiac action potential do the beta blockers affect? I'm getting tired here. Okay, so remember that it's phase 4 here. Okay, what is the appropriate treatment for Clostridium difficile? Is it A, metronidazole? Oops, no spelling. B, Bactrim. C, amoxicillin. D, amoxicillin and or clavulanic acid. The answer is A, metronidazole. Remember, metronidazole and C. diff. Next one, which receptor inhibits adenylate cyclase, decreasing CAMP formation? Is it A, alpha 1, B, alpha 2, C, beta 1, D, beta 2? The answer is B, alpha 2. So the rest stimulate. So remember that CAMP is produced by adenylate cyclase and then serves as a regulatory signal via specific CAMP binding proteins, either transcription factors or other enzymes, e.g. CAMP dependent kinases. Good to know. More information? No. Which of the following is classified as an alpha 2 decreasing CAMP? Is it A, cisplatin, B, salbutamol, I may not be spelled right, C, clonidine, D, atenolol? Okay, I'm wondering if I should have written an alpha 2 agonist or antagonist. I think it's agonist. So the answer is C, clonidine, for the alpha 2 agonist. So clonidine is a non-selective agonist and is an antihypertensive drug which leads to a decrease in intracellular CAMP, and it is a sympatholytic medication used to treat high blood pressure. Okay, more on the alpha 2 adrenic receptors. They are classically located on the vascular prejunctional terminals, where it inhibits the release of norepinephrine in a form of negative feedback. This is important because you might think it's an agonist, it's going to turn something on, but it's actually turning things down. It's to mellow you out. It is also located on the vascular smooth muscle cells of certain blood vessels, such as those found in skin arterioles or in veins, where it sits alongside the more plentiful alpha 1 adrenic receptors, frequently used in veterinary anesthesia, where they can affect sedation, muscle relaxation, and analgesia through the effects of the central nervous system. So just trying to say that it's used to put animals under, and you can notice again that it's working on the CNS. Clonidine works on the CNS. It is an alpha 2 agonist. Remember this, because you always get it wrong. Okay, beta 2 receptors cause what reactions in the body? A, bronchoconstriction, B, bronchodilation, C, platelet aggregation, or D, lipolysis. You always get this wrong, but if you remember the pig, the parasympathetic pig that is sucking on the oxygen, you know that in the resting phase, the pig, or we are needing oxygen, meaning that the lungs are constricted. So be careful if you're giving a beta blocker, because you can cause lung constriction. So this question needs to be talking more about whether it's an antagonist or agonist. But basically, you should know that if you're giving propranolol to somebody who has a migraine, you could kill them. So asthma plus migraine can kill somebody if they have some other trouble. You're trying to control it with a beta blocker. You better be careful. So never take a beta blocker. It will stop albuterol, for example, if someone has asthma. It is always a blocker in the airway. It depends. You may get one that causes vasodilation in low doses, but vasoconstriction in high doses. It's kind of complicated. But anyway, don't get confused. Think about the parasympathetic pig. He was sucking on air because always constricted in the resting state. So when talking about beta receptors, you must think about whether it is a beta agonist or an antagonist. Next, what is the mechanism of action of atypical antipsychotic agents? A. Inhibition of dopamine receptor. B. Inhibition of 5-HT2 receptors. C. Increasing the levels of 5-HT2 and norepinephrine. And D. Increasing the levels of dopamine. The answer is B. Inhibition of the 5-HT2 receptors. So what are those two receptors? If you remember, the mammalian 5-HT2 receptors are subtype of the 5-HT2 receptor that belongs to the serotonin receptor family. So when you hear the 5-HT2 sound, you know it's serotonin, because it was also found to be mediating, or at least partly, the action of many antipsychotic drugs, especially the atypical ones. Looks like I cut and paste something here. Next, all the following are side effects of diphenhydramine except. So this is an antihistamine. So choice A, dry mouth. B, sedation. C, tachycardia. D, diarrhea. E, mydriasis. Remember mydriasis and meiosis? Mydriasis is the sympathetic effect, and meiosis is the parasympathetic effect. Mydriasis, you would be dilating, and meiosis, your eyes would be getting smaller. Not eyes, the pupil. The answer here is D, diarrhea. There is no diarrhea as a side effect of antihistamine. Okay, I'm getting silly here. Next, all of the following are beta-lactamase agents except A, cephalosporin. B, penicillin 5. C, tetracycline. D, monobactams. Or E, carbapenems. The answer is C, tetracycline. Remember that tetracycline is not a beta-lactamase agent. Okay, it's very important. Okay, we take a break there.